Well, thanks for tuning in. My name is Tim Lewis, Member of Parliament for Kitchener-Conestoga, and welcome to our series of Fireside Chats. So today's special guest, I have the great opportunity to speak with the Minister of Families, Children and Social Development, the Honourable Ahmed Hussen. Minister Hussen was born in Mogadishu, Somalia. He and his family left Mogadishu after the Somali Civil War reached their neighborhoods. They came to Canada. He completed his secondary school in Hamilton and then attended York University, where he earned a BA in history, received a law degree from the University of Ottawa, and specializing in the practice of immigration and criminal law, practiced law, and then in 2015 became the Member of Parliament for York South Weston. So it is indeed my honor to welcome the Honourable Ahmed Hussen. Thank you for joining us today.
Thank you so much, Tim.
Well, thank you for joining us virtually, I should say. I mean, normally a fireside chat, one of us is by the fire here, but only one of us. So I have to ask the first question. How are you and your family, your wife, your children, how are you coping as a family?
We're doing really well. The kids are not going to school. I have 3 young boys, but we're managing well. We're staying safe, and I hope the same for you. I just want to start by really thanking you, Tim, for putting this together. And I want to tell all the participants and the viewers of this virtual meeting, virtual fireside chat, that from the very beginning of this pandemic, Tim has been an amazing voice for Kitchener-Conestoga, an incredible advocate, and he's been engaging me and many other ministers on the COVID-19 response to make sure that the people of Kitchener-Conestoga's voices are heard, that families are supported, that children are supported through this, seniors, workers, businesses in the nonprofit sector. And today we'll have a chance to talk about all of the above. But central to that, I really wanted to pay tribute and highlight the contributions of Tim Lewis as a key voice for Kitchener-Conestoga in Ottawa, and as an advocate, someone who really views their role as a Member of Parliament to be the voice and the advocate to represent the interests of everyone in Kitchener-Conestoga.
Well,
thank you.
Thank you, Minister. That really means a lot to me, and you've set the bar pretty high. So you've always been there with advice. It's only been a few months since I became Member of Parliament, and right away I wanted to be a voice for everyone in the riding, and I just did not think the need would be so pronounced this quickly. So many people have stepped up. Since we opened our office only months ago, so many people came that needed help, that needed to rely on the programs that were rolling out, that had such a pronounced need, and it's amazing to see communities come together. The government was faced with COVID-19. I was really impressed by how quickly the federal programs were rolled out. The feedback that we received from our constituents, we sent up to Ottawa, to the ministers, to people like you, up at the Prime Minister's office, and the response was there, whether it's our own constituents sending it in, whether it's listening and cooperating with the opposition MPs. It's amazing to see how fast some of these programs were put together. And a number of these programs are all going through Service Canada. And you, as the Minister of Service Canada, even with staff working from home themselves with the same situations that we're facing with health concerns, with family being at home, with working from home and working in this new norm, Service Canada really did an amazing job stepping up, and the service that they're providing and that they're able to help us is tremendous. So as the Minister of Service Canada, I wanted to thank you and your whole department from Kitchener-Conestoga and indeed a grateful nation. Programs like the Old Age Security, the GST, HST credits, all going through Service Canada. Can you shed some light on the differences that we face now versus only a few months ago?
Absolutely. So Service Canada, COVID-19 pandemic has presented quite a challenge to us in Service Canada. As you know, we had to be very cognizant of the health and safety of not just the workers and our team members in Service Canada, but also our clients, Canadians who used to come to Service Canada centers to get services. So in order to completely eliminate the possibility of the spread of COVID-19 pandemic, and in consideration of the health and safety of our Service Canada team members as well as Canadians, we made the decision to shut down those service centers. But we made sure that the key point is that the services to Canadians must continue. So the format has changed, but we beefed up our ability to serve them online, our ability to serve them over the phone. We have added an additional 3,000 team members to Service Canada so that they can serve and deliver benefits to Canadians faster in the midst of COVID-19 pandemic. We've also set up a 1,500 agent call center to answer questions on the CERB, the Canada Emergency Response Benefit. And I must say, the work of Service Canada has been exemplary. Just to give you an example, on the EI benefits, it used to take 28 days from the time someone applies for EI benefits to the time that a payment would go out. After March 15th, anyone who applied for EI after March 15th and all those cases, plus the CERB, we're getting those payments out in 2 days. Two days. And it's been really fast. So 99% of the Canadians who have applied through the new system have gotten their money in 2 days. In addition to that, we have reached out with thousands of community liaison officers to vulnerable populations and people who don't have access to the internet so that they can use the phone. And even in cases where, exceptional cases where people are not able to maneuver the process through the telephone, we've set up in exceptional cases, personal appointments to help walk people through the process. But we've made the process so simple that 99% of the people applying have figured it out.
Yeah, and most people, when we direct them to websites, Canada.ca website, it is enough to get them started. There's a Canada Business app that will help with the response. But there are people, and right up to recently, that people that are calling the office and they don't have the technology, whether it's because of rural neighborhoods or socioeconomic conditions, that they simply call, and we can have these conversations, and we can talk them over the phone, and it's wonderful because these programs didn't exist. It's not like we rolled them out quickly, but they were planned. This is the work of the government, of the cabinet members like you, putting these together and then working with Service Canada to implement them faster than anyone would have imagined. So again, I thank you. And programs like
and the credit goes to the Service Canada employees and team members who really worked day and night to set up the system. And I was a little nervous on the first day. We had hundreds of thousands of people applying for the CERB. And within 2 days, they had their payments. And I was really afraid that the system may not be able to handle that level of volume, but it went by very smoothly. And I'm very appreciative and grateful to those Service Canada team members who worked for weeks to set up that amazing system that we now have.
The Canada Emergency Response Benefit is one of the things that I am most proud of as a member of Parliament and able to help people, because up until a few months ago, myself, I was self-employed for as a musician, as an artist for all my life, and people that weren't eligible for unemployment insurance would have fallen through the cracks. And I think the feedback that we're getting most are people that are on the CERB and are happy and are able to then keep the roof over their heads and put food on the table for their families. It's much appreciated, and then that work is going well. Which brings me to the next program that I wanted to talk about, was the Canada Child Benefit. Yes. That was, we changed that up and implemented after the 2015 election, and now it's targeted to the families who need it the most. And it was there, and all of a sudden, again, in the COVID world and this pandemic world, we needed to further enhance it and increase it now. So I wondered if you could comment on that.
Oh, absolutely. So I'll give you the backstory on the Canada Child Benefit with respect to Kitchener-Conestoga. But before I do that, I just want to say that because of the Canada Child Benefit, we've been able to put more money in the pockets of 9 out of 10 families. So in the past, the government of Canada would simply send child benefit checks to everyone. That meant that millionaires would also get Canada Child Benefit. So people who didn't need it would get the same amount of money as people who actually needed more supports. So what we did as a new government coming into office is we stopped sending checks to millionaires, and we put those savings to provide more support to families with children who needed more supports for the cost of raising children. The second thing we did, which is really crucial, is we made the Canada Child Benefit tax-free. In the past, you used to get Canada Child Benefit checks, and then the government would claw back some of that amount in taxes. So for Kitchener-Conestoga, as beginning April 2019 till now, we have had 11,250 payments, 22,230 children have received money under the Canada Child Benefit. The average amount of payment in Kitchener-Conestoga has been $580, and the total amount of payment so far has been $6,557,000. This time, last year, approximately, as I said, 11,250 families received over $6.5 million. But this year, on May 20th, we had that additional one-time payment of $300 to help families with children who are already receiving the Canada Child Benefit to receive $300 more per child under the Canada Child Benefit. That top-up will bring the total amount of Canada Child Benefit money that has been distributed in Kitchener-Conestoga from $6.5 million to $9.5 million to families in Kitchener-Conestoga in the month of May. So it's pretty significant. I just want to add one more thing. On July 20th, we will also have that regular increase that we've had for the last, this will be the third year in a row where we will have another increase in the Canada Child Benefit to take into account the increase in the cost of living. So every year when there's an increase in the cost of living, we also raise the amounts that we provide to families with children under the Canada Child Benefit. So in addition to the one-time $300 payment on May 20th, on July 20th, we will have a permanent increase in the Canada Child Benefit to take into account the increase in the cost of living. And this would be the third year in a row in which we've done that.
Mm-hmm. Well, and that's very much appreciated here and across the country. And the people that need it more are getting more. And also what's appreciated, people would call up and say, call our constituency office in Kitchener-Conestoga and say, what do we need to do to sign up for this extra funds to keep up with what happens here? And it's taken care of. And these are automatically, these are targeted for inflation as the cost of living goes up. It lets people make the healthier choices. It lets them take care of their families, and it's even helping our local economies because that money stays in our neighborhoods, and the very same people who have children are the ones that have businesses. So it really is a smart way to help everyone, and it's again most appreciated. As much as we're helping people, there are always people that would be harder to reach and just kind of below that level that we can get out to. People might not have the same internet access or the same supports or the same bank accounts. And so we have a very vibrant not-for-profit and charitable sector here in Canada. And that's always been a way to reach out to our marginalized society. They're on the ground, they know how to work. We've got Community Care Concepts and Wilmot Family Resource and Woolwich Community Center and all of these places that are doing some great work. I know you came with me to visit in Elmira to the Community District Living to see some housing. And so you see the need is there, and our community is always willing to step up. But a lot of the non-for-profits, the charity sectors, they rely on donations from our communities as well. And at times like this, they're not having that revenue, and they're closed, and it's harder to do that. So maybe you could talk to me about the Emergency Community Support Fund.
Yes, absolutely. This is something that I'm very, very much proud of. And Tim, you and other members of Parliament really fought hard for supports for non-profit organizations and charitable organizations that are helping the most vulnerable populations get through COVID-19 pandemic. So we are helping the helpers, and you and others fought for that. You wanted us as a member of Parliament and other members of Parliament to pay attention to that. Because there are people who, despite our best efforts, local community-based organizations are in places like Kitchener-Conestoga. They can reach those populations even better than the government. So we have responded by providing a $350 million emergency community support fund. That money is meant to support those nonprofits and charitable organizations that are providing services and material to vulnerable populations. Think of seniors, for example, who are being helped by delivering food and medicine to seniors, or delivering counseling services and other mental health supports to people who are going through difficult times in the context of COVID-19 pandemic, or even organizations that are helping vulnerable populations access their benefits by helping them to file income taxes. Every year we get hundreds of millions of dollars coming back to the government that should really be going to Canadians who are eligible for those benefits, but they don't get them because they don't file their income taxes. So there's organizations that are doing that. So the $350 million is to increase the capacity of those organizations to not only continue to do the work that they're doing serving vulnerable people, but to actually increase that amount. Two conditions that nonprofits and charities need to access that money. There's only two simple conditions. One is they have to be a nonprofit or a charitable organization. And the second thing is they have to be serving a vulnerable population or one or more vulnerable populations in the context of COVID-19 pandemic response. So delivering food, delivering medicine, helping people get through these difficult times through mental health supports and counseling and other services. So if you know of those organizations that are doing that work in Kitchener-Conestoga, please ask them to contact your office and also our office. And I'm always happy to help Tim to help those organizations access that money, because that money is not just for the large national organizations, it's also for the small community-based organizations that are doing the heavy lifting in places like Kitchener-Conestoga.
That's right. You've used the United Way and Canadian Red Cross to distribute that.
And the community foundations of Canada.
That's right.
They can go to any of those three.
That's right, and we have all of all those in our area, and they are getting it down to the ground. Unfortunately, some of these programs were meant to connect people, right, with seniors, to bring them out and connect them. And it's amazing to see how fast everyone responded and learned how to help. Now it's about keeping people home, keeping them safe, bringing them food, bringing them resources, the medicines they need. And it's amazing to see this kind of Team Canada approach. These organizations helping and cooperating with each other, with police services, with frontline workers, volunteers doing their best to step up and deliver meals. It's inspiring. It's inspiring to see. So, but before we leave, I got a little more time, and I know your time is short as well. So I wanted to know if you, again, we mentioned the last time you came to visit, we went to Elmira, the Community District Living, but we had a national housing strategy in place, and that remains important. It remains more critical than ever to make sure that people are safe and have food on their table, but have a roof over their head. So can you tell me how the national housing strategy has been affected during this time?
It hasn't been affected at all. We are continuing with the projects that we have been funding through the National Housing Strategy, including in places like Kitchener-Conestoga, putting more affordable rental units in the market through the Rental Construction Financing Initiative, putting more affordable community housing units on the ground through the National Housing Co-Investment Fund, funding municipalities and communities to put projects in place through various funding pockets in the National Housing Strategy. But equally important, as a result of the pandemic, we moved very quickly and very early to provide substantially more additional supports in terms of real dollars, federal dollars, to go directly to community entities right across the country that are serving on a frontline basis, that are helping the homeless population. And so we invested, in addition to the regular amounts of money that we invest to fight homelessness, we invested an additional top-up amount of $157.5 million, plus going to those frontline organizations tackling homelessness right across the country. And $50 million on top of that going directly to women's shelters and sexual assault survivor centers. So that has, so number one, that's additional money. Number two, we made the funding flexible, and we trusted the community organizations, and we said to them, as long as you're using this money to help the homeless population, to respond to COVID-19, to prevent COVID-19 outbreak, or to manage a potential outbreak within the homeless population, you're free to use this money in whichever way that you feel that you need on the ground. That means some of them have used that money to acquire hotel rooms, motel rooms. They've used it to acquire personal protective equipment. They've used it to acquire cleaning supplies and other essential supplies. So it has been really effective in enabling us as a country to really prevent an outbreak of COVID-19 pandemic within the homeless population. And when there has been small outbreaks here and there, to manage them and to contain them. One thing that I want to bring up to your attention is that for the constituency of Kitchener, for the region of Kitchener-Waterloo, we have had a base allocation of $809,000, which we were always going to provide and which we provided in April. But because of COVID-19 pandemic, we provided an additional top-up amount of $2.1 million. So the regular amounts of money that comes from the federal government for Kitchener-Waterloo to tackle homelessness is $809,000. This year, because of COVID-19 pandemic, we know that those organizations will incur additional expenses. We have given them an additional amount on top of the $809,000, $2.1 million. That is a 268% increase over the regular amounts that we give, and we've made it flexible. And because that money is substantially more than the regular amounts that we give, we are allowing the municipal governments and the regional governments in places like Kitchener-Waterloo to then free up resources that they would have used for homeless programs, because the feds have stepped in, to then permanently solve permanently house this homeless population by acquiring permanent structures, as opposed to just investing in more shelter space, by, instead of renting motel rooms, acquiring the property outright, building quick modular housing and other rapid housing initiatives. So this money is really helping encourage local leaders to think beyond COVID-19. And we will be there for them. And I've told the mayor of Kitchener, Waterloo, the mayor of Kitchener, the mayor of Waterloo, that beyond COVID-19 pandemic, during the recovery process, we will welcome any projects for social housing, for affordable housing and affordable rent, to permanently house the homeless population in Kitchener-Waterloo region. And I encourage them to bring those projects forward. We haven't stopped addressing that issue, and I will be there to make sure that we get those projects across the finish line, working with you, Tim, and other wonderful members of parliament from Kitchener-Waterloo, so that we can move people away from the street, not just to temporary housing, but to permanent housing under the National Housing Strategy.
No, and that's extremely appreciated. We talk with the mayors on a regular basis, and the MPs in the region. We're in constant communication, and there are plans to be made exactly like you're talking about, modular housing and protecting the most vulnerable in our society. So I know your time is short. I want to thank you so much for your time, and I hope that you stay safe, you and your family. And please, thank you on behalf of a Grateful Nation for all the work you're doing for everyone. It's very much appreciated, and I hope to see you in person next time. So
absolutely, thank you so much, Tim. I really appreciate this opportunity to talk to your constituents, to talk to the residents of Kitchener-Conestoga. It was a pleasure coming there and knocking on doors with you. And I know that since the election, you haven't stopped knocking on doors. You haven't stopped engaging residents, even in the context of COVID-19. And
it's phone calls now, yeah.
I love working with you. You're a great colleague and a great voice for Kitchener-Conestoga. Thank you so much for everything.
Well, thank you, sir. Appreciate your time. Thank you. That was the Honourable Ahmed Hussen, Minister of Families, Children and Social Development. And I'm Tim Lewis, and I want to thank you for tuning in to our Fireside Chat. Please stay safe, take care of each other, take care of yourself. Thank you. Bye for now.